All right, everyone, welcome back to another episode of Blue Grit Radio. We are talking about wellness. We're talking about the big wellness that really kicked off all of this project with Blue Grit Wellness, officer wellness, and all the prongs therein. But one thing that I'm really excited about in today's guest and our discussion is talking about wellness as it relates to community wellness and the interplay there and how community has absolutely a role in that. Without further kind of giving you some of the lay of the land that we're going to talk about, bringing in Dr. Carolyn. So, Carolyn, thanks so much for joining us today.
Thanks for having me.
Yeah, absolutely. So, I just kind of want to kick things off and say thank you and say I'm really excited to feature what you're building and what you've been working on alongside ATI and some of the take on this interplay between officer, first responder wellness and the wellness of the community, but then also having this kind of call to action from the side of the community. You know, you being a doctor, clinician, and so I kind of wanted just to ask you to introduce yourself a little bit of your background, and then what brought you into this big this big conversation that we're going to be having today.
Absolutely. So, I like you mentioned, I have a doctorate in occupational therapy, and I work as a clinician, primarily specializing in my career within concussions and brain injuries. And over time, I've really focused on high level performance community members, whether that be elite athletes or first responder populations, but really focusing on that extra level of care when just your simple OT visits won't cut it. Where do you go for that next level to get back to the things that you need and want to do so that you can live a life of meaning and purpose? And so that's always been my drive. And that kind of has evolved from elite athletes into a much more prominent field of how we relate with our community. And that's really driven my current engagement into the first responder space.
Yeah. Well, I love that. And I think that most of us perk up, even the people that aren't like rah fitness, health, holistic health and wellness, when they hear performance, they perk up because they're like, okay, yes, like that's what I can get behind. There's a lot of folks that I've met in the career that they're not necessarily like into fitness per se, but they are into performance. And it's almost like eating broccoli. They're like, yeah, I know it's not my favorite thing, but I know it's necessary for me to do the job and serve well and do the things I want to do. And I think that that is a relevant point to bring people into. Can you talk a little bit about your background with that performance? And you mentioned elite athletes, and I love how a lot of people are recognizing that there's so much we can learn from this athletic performance side, and not just for the obvious physical aspects, but the interplay between all aspects of someone's health.
Yeah, I think oftentimes when we talk about performance, our mind immediately goes to the highest level of can you execute a hard takedown on uneven surface with someone giving a lot of pushback or restraint. But what we forget to think about is the performance in those day to day moments between that actually make up your career. And I think that goes into how do you get out of your car? How do you take care of your body in downtime? What are you doing when you're at home with your family to promote reduction of stress, reduction of trauma, and not taking as much of the job home with you so that you can show up better for your brothers and sisters in the field to do your job as best as possible. And so I really saw this evolve when I was starting, even in undergrad. I was working in an athletic training room and I was working with a bunch of teams and just saw how necessary that cohesive team identity was. Right? They had to be able to lean onto each other to show up for each other and trust that their teammates are taking care of themselves. Because if they don't, they're not going to be able to represent the team well. And so when I was going through my doctorate, I did my research in the experience of medical retirement from elite athletics, had the opportunity to speak to some really high level athletes about their experience of losing that primary identity of being an athlete and finding what's next. And I think that conversation is one we often shy away from because our job as our identity is such a prevalent idea within our culture that when we start talking about what's next or what's more, we start to lose focus and we start to feel a lot of fear, a lot of shame, a lot of guilt come up around those conversations. When in actuality, when we think about that sooner rather than later, that's when we see health evolve within the career itself and we're able to show up better, perform better, and be there more for our community.
Yeah, yeah, that's huge. Just to go back, there's one point that I love that you made, which is it's not necessarily like the big takedown, right? It's not like that that fisticuffs with a really large, strong suspect. It's the little thing. It makes me think of that adage like death by a thousand cuts. And when you said
Right.
like getting in and out of the car, like I've shared that example many times, which to date myself, like the start of my career was in a Crown Vic. And I remember like being in shape and not being super heavy, but at the same time having all this like strain on my left knee because that's like the knee I would push off. And I started modulating how I was getting in and out of the car. Like I'd grab the roof of the car, I'd pull myself up. And so that's just like a thing that I realized happened in my career. Another one later in my career, there was a time when I was really into lifting heavy and lifting upwards of 500 in a deadlift. And this is not like a humble brag. I don't lift anywhere near that anymore. But it is to say that it was like moving a paint bucket when I was doing graffiti cleanup in this specialty unit, like this
Yeah.
community focused thing. Like I was bent over weird because it was in the back of a van, and I just tweaked my back and my side. And when I got checked out, they did an X-ray, which was really cool. But she said that my spine was like all kind of wonky beyond just in general. She's like, I don't think this is the injury. I think it's a flare up and a strain, but she's like, it's kind of torqued weird. And I'm like, is it like torqued this way? And I'm kind of twisting to my right, like I'm typing in a car. She's like, that's exactly the direction it is. I was like, cool. Cause that was years of typing in my car as much as I could, which for listeners, please don't do that. Like, I get the small things, try to get out of your car. It's a long career ahead. But these are the things that flare up personally in my mind as you explain. It's the little things sometimes that can cause that larger injury or incident.
Right. And I think sometimes when you have those moments of, you're used to lifting 500 pounds and then you're bent over at your car, it's kind of this moment of reckoning that's very humbling. And you're just like, oh my gosh, what's going on? I thought I was ready for this. I thought I was prepared for this. And so then when you're in the moment where you're kind of countered with, I don't know if my body is fit to perform in the next moment, that creates this whole other mental schema that can really impact your ability to show up in the next moment.
Yep. And yeah, it makes me think of there's a lot of reels and memes about lifting with perfect form. There's this influencer I remember from a while back that would go around the house and do chores using like perfect form for squats, and it's just awkward. Right, he'll hold out like the laundry like with straight arms, but then it makes me think of how the world doesn't operate like a gym. Right, it doesn't like the things you pick up aren't like dumbbells. They're not kettlebells. They're not perfectly balanced. You're not like putting your feet on the same plane all the time. So with that, I'm curious, like, what comes to mind for you when you think about that and the world we exist in, the conditions that are ever changing, and how we can think about this concept of tactical athlete and that preparedness for what life and the job throws at somebody.
Right. I think oftentimes within any fitness community, there's that phrase time under tension, where the amount of time a muscle is under tension is directly related to this strength development. But I think when we start looking at the overlay to day to day functional performance, we also need to look at the time under chaos.
Mm, time under
Because,
chaos.
like you said, we don't know what we're going to show up to. And especially if I'm working with a first responder, as a clinician, I need to make sure that they are able to operate in those high stress environments. And so my job is to put them through as much chaos as possible in a controlled and safe clinical environment to be able to help them feel confident that they're not doubting that their body is capable, that they're not wondering what's going to happen next and whether they will be able to show up, whether it be for the next call or whether it'll be to carry their kids and put them to bed that night, right? They need to be able to trust that what they've done in preparation is not just enough, um, but is continuing to help them evolve forward.
Yeah, no, that's huge, and it makes me think of the mind body interplay there, and the confidence really matters. It's like if someone thinks about how they're gonna re-injure something, like I don't have the data, you might, but like that happens. Like there's a lot of people that have stories like that. Yeah, I was worried about this thing and then it happened versus like actual, not just fluffy self confidence boosting, but actual time in the clinic with somebody that understands. And if people haven't picked up, maybe this is a time to shout out that Dr. Carolyn, a lot of what we talked prior about was making sure that you understand the rigmarole of the job, right? And you do from ride alongs and embedding. And so I'm curious if you could talk a little bit more on that. And then also, like, so you could paint the picture. What does that look like when you're introducing that, maybe that that limited, safe environment to inject all that chaos for someone to interact with and test themselves in.
Absolutely. So to answer the first point, we're really talking about that cultural competence of the clinician. And I think that's the first step is if you're asking officers to invest their time to take care of their wellness with this new entity, this new person, they need to know why to trust that person.
Hmm.
And a big part of that is that officer can't be showing up to therapize the therapist. The worst thing that can happen is they show up and they're having to tell the therapist, well, this is what my day is. And the therapist is like, oh my gosh, that's awful. How do you cope? Because that doesn't fix the problem, right? And we can do lectures all day about the nervous system or anatomy, but what's what's the next step, right? Where do we actually find the movement pathway forward? So, from more of that physical perspective, whether you're working with an occupational or physical therapist, and I will put in a plug here, yes, they're two separate disciplines, and both are, I think, very valuable to have in this space. We need to start thinking about how, as a clinician, you take care of yourself and how you show up for your patients.
Mm,
How do you regulate yourself so you can sit with an officer who might have just shown up to a really traumatic call and is coming to see you for low back pain? And maybe your clinical findings aren't significant for a severe musculoskeletal injury, but you're seeing the interplay of stress on musculoskeletal disorders. And there was a really interesting study, I believe it was in Brazil, of about 150 police officers, and it was talking about how perception of stress and symptoms of musculoskeletal disorders are directly correlated with one another. And so when we start to understand that as a clinician, we can't just look at, does this muscle work? Does this joint operate how we want it to? We also have to take in that larger picture of what are the last 2 months of calls looking like? What is the community support looking like? What else is going on in our geopolitical sphere that might be impacting how this person is showing up in this day? And how do I shift my own approach to make sure that we're facilitating an area that develops the trust to be vulnerable? We're not just implying trust or implying that there's safety and vulnerability.
yeah.
There needs to be the work from the clinician to really establish, yes, this is appropriate, and here's how I'm going to help you.
Mm,
Think to the second part of your question, that's really where having the opportunity to be in house makes a difference. And I'll speak to sitting in on some de escalation training with the Edmonds Police Department last spring. And they were running through drills and they weren't at full speed or anything like that. But as a clinician, being able to take a step back and watch how people are moving their body and how they are using their breath or how they are using their skills of regulation, both physically and emotionally, um, to execute each task, my mind was just flying with, okay, here's how
mm,
I'd simulate that in a clinic, or here's how I would go into that department and be able to use their equipment or use their opportunities for training to make sure that this is salient, that this will be able to translate onto the field. And I think that's the next piece is like, are you just training with dumbbells and barbells? Or are you saying, hey, bring in your vest, bring in whatever equipment we can. Let's do this as realistically as possible. And I think that's what makes the difference between your average experience of rehabilitation versus the experience that we're really seeking to provide.
yeah. Yeah, you said a huge phrase that is socialized, fortunately, in the mental, emotional health space, and that's cultural competency. And so for you to carry that theme over into a different type of clinical work with the body, and then also recognizing the interplay with physiology and the mind, like that's huge. And if anyone gets anything from this episode, I hope it's that, which is like people need to understand. And like one of my biggest phrases that I push out to people, whether they're trying to learn about the career or whether they're trying to develop their relationships, it's like, stay curious. And that's what I hear that you've done. And people like you are the ones that are going to really help us along because you're not just looking at something on paper, giving the example that you had earlier, which was, yeah, I don't see that necessarily a lot of like, I forget exactly how you said it, musculoskeletal, or, but basically you don't see like a physical injury so much. But I think for people, to explain it to a younger me, what would have made sense is like, hey, we all realize that we hold tension in certain places, and a lot of times I realized it when my loved ones or my buddies, my more like, physical touch kind of buddies would slap a hand on my shoulders and be like, "Dude, you're tense." And then they would just kind of push on it, not very hard, but it felt painful. And it's just because of where I carry,
Yeah,
right? So like how much worse that feels. And then we can recognize in this type of job, you're probably carrying your stress somewhere. And so whether or not you see that injury, but to have the whole context and know the job. I love how you brought up like even the gear, because if a clinician doesn't know anything about your job, doesn't even know what you do, and you're just talking about an injury, well, they might be losing and missing out on a lot of relevant information if they're trying to quote unquote get you
right.
back to duty.
Yeah, I think one of the key examples that I see everywhere, just as a member of the community walking around, is when officers are wearing their vests and they have their thumbs hooked into
Mm,
their armpits.
it's a
And you just
stance.
see that posture change, right? And I know a lot of departments are like, we hate this, we're trying to break this habit. And one is for the performance aspect. Are you able to respond quickly? But the other, when we start looking at physiological health, when we start doing that and our chin goes forward or the neck goes back, we start getting that forward head position, we start putting a lot of tension into the neck. And so if we already have high levels of stress, we're already having compromised amount of time to get in the physical activity and exercise that we need to help those muscles self-regulate. We're setting ourselves up for years and years and years of bad posture just because of this habit that in the moment is comfortable because we don't necessarily have either the comfort to know what to do with our hands, right? Somewhere else that feels okay and that we've practiced putting them there, or we don't have the muscular strength and endurance to actually hold our arms in a different position for the duration of a workday.
Yeah, it makes me think of like the downstream consequences. Like we remove a lot of weight from our belts, which I love personally. Like that was a wrecker for me.
Yeah.
Like I don't have solid hip base, but to put my weight up higher and distribute it is great. But then it's like it's not a fix all, right? There's pros because you can take it off in the office and this and that. However, you do point out like there's no silver bullet, and like how are we accounting for that? Man, my gut is like I have my own personal bias for the tactical purposes and some of the material I reviewed, which is like don't stick your hands all the way in like a hand warmer. But yeah, like if you put your hands like in front with your fingers curled in the top, or you put your thumbs in, you can react and access things and free your hands better. But from a clinical standpoint, do you have thoughts on that? Like, is there one position that might be better, or is it toggling your positions?
I think this is somewhere where we also need to consider the differentiation of every single body that's showing up,
Mm,
right? Whether we're dealing with male, female, body composition, experience working out, duration of career, everything is different. And so I think that's really where we start to look at where is the skill in training? Are we using a one size fits approach? Or are we able to say after that, like, hey, this system isn't fully serving everyone we need to? And so, where are we catching not even the outliers, but the vast majority? Because training, we only have the opportunity to train to the average, right? And no one is actually that average person. That's
yeah.
like your classic fighter jet cockpit example where it was made for the like average fighter pilot. And they were like, yeah, this is less than 1% of who is actually in these seats. And so when we start looking at that on a broader scale here too, that applies to everything we're doing in training. And so after the fact, how are we taking care of someone across the longevity of their career to make sure that we're not just saying, hey, here's the average, here's what we think should work based on these large numbers. And we're actually saying, you know what? Yes, and for you, here's how we are going to modify. Here's how we're going to look specifically at your factors to be able to provide the best experience possible to reduce workplace injuries, to reduce onset of chronic pain, and to, again, be able to make sure that you are able to walk away being like, you know what, I did what I needed to take care of my body for myself, my family, my community.
Yeah, thank you for outlining that specificity because again, like we want to develop these things that are good for everyone, but there needs to be nuance, there needs to be expertise and like personalization, and people recognize that from any aspect of health. Like our lives are not the same, our careers might be similar and our assignments might be similar, the type of calls we go to, the type of work we do might be similar, but yeah, our physiology is way different, ages, athletic ability, muscle density, all these things are going to affect how this wears and tears on us. So I love that you point that out. Can you tell us the difference between an OT and a PT?
Absolutely. So there's a lot of crossover between the two. And I think a lot of times we think of them as sister professions because they work so well together. And my bias is that I love interdisciplinary work. Like the more I can work with more people and pull more brains in to grow and to be able to lovingly step on each other's toes, I think that's where we do our best work. So I think of physical therapy as the experts of movement. So they're really focused on how our muscles, skeleton, and neurosystem are working together to produce the movement quality and the movement endurance that we need. Occupational therapists have a little bit of a broader career scope. So occupations we define as the things that you do to occupy your time. So from the moment you wake up one day to the moment you wake up the next day, you've occupied 24 hours in some means. My job as an OT is to look at how your physical, cognitive, and emotional performance allow you to do these tasks to the degree that you need to do them. So that means that I'll overlap with a physical therapist and looking at the physical component of the job. I'll overlap with the psychology team by looking at that mental health perspective. And I'll interact with more of that cognitive therapy, whether it's from speech and language pathology or neuropsychology, to look at the actual cognitive performance. And so, really, when we start to look at that, it creates this beautiful Venn diagram that performance lies in the middle of so many of these different factors. And again, I think where OT plays a key role is my job is to look at the entirety of the task that you're doing to create your ideal performance. So I'm also looking at your environment and the task itself to say, what are the goals of the task? How are we getting there? What are all of the different pathways to get there? What are the barriers and supports that we have available to us and how do we optimize? So as as we've had this conversation, both with colleagues and friends and within the healthcare system, we've talked a lot about like PT is a great early intervention specialist, like right after an acute injury, but then handing over to OT for that finessing of can you actually apply it to the job? What is the application of what you've learned and how do you make sure it's successful? How do you practice it so it becomes rote muscle memory?
Yeah. Yeah. No, thanks for underlying those concepts that resonate so much with me. One is team, right? Like you have all these specialties, but how do you up level? How do you get that 1 + 1 = 3? And that's by talking, by collaborating. Everyone knows somebody that's had hiccups in, like, let's just say the medical system, when you have like one specialist that's just giving
Yeah,
this report, and then you kind of need this like handler, like this coordinator to bring all the stuff together. And it's not like to point fingers, but it is to say like this is where communication gaps and breakdown don't help an organization or a team, right? That's the fallout is when you don't have that. It's almost like if you had a business and sales the sales team's like, man, we're not getting any we're not getting any leads, we're not getting a response from our customers. We need to reach back out. Is it the people in the mailroom? What do we need to handle? But if the IT department was dealing with like a broken server and they didn't tell anybody, then we're going to put all our energy in the wrong places. We're not actually going to fix the issue.
right. Yeah, and I think sometimes we think of quantity of care rather than quality of care. And we start saying, okay, we need to pull everybody in rather than we need to look at who are the right people to be at this table and how are we centering that perspective of the individual that I, as a clinician, am serving, right? The patient, the officer, how are they leading this conversation? Because my role is to make sure that they are the ones who are feeling empowered, that they are the ones feeling like they are making choices rather than me just telling them, hey, you need to go do this. Because ultimately, and I think this is another piece that speaks to what to look for in a culturally competent clinician is first responders are always being told what to do, right? Whether it's from internal ranks or from the community itself, there's very little autonomy that's granted within that day to day. And so the more that we can show up and say, here are some different choices that are evidence based and available to you, how can I support you in taking this next step? How can I meet you where you're at and support that accountability to the career that you want and to the life that you want?
Yeah. Yeah. What does that look like? Do you have examples of that where like starting with autonomy and empowering the patient or the first responder has really made strides? Because yeah, we can think about the stubbornness that comes with our types, and I think that's just awareness, right? But a lot of times it's hard to be open to these concepts that you're not very familiar with.
Yeah, I think part of it is just how you show up to a session in the first place. I I mean, in the conversations we've had, I think you've got to know I'm a pretty straightforward person. I don't beat around the bush too much. So when I tend to have an evaluation with someone, I'll just tend to say, hey, our goal today is to hear what your experience is, to do some skilled testing to be able to identify what's going on, where it's coming from, to talk about what my recommendations are, and then to make sure that you have a plan where you're feeling more confident leaving today than you were when you came in. And so my job as a clinician is to make sure we achieve each of those outcomes and to facilitate the conversation in those directions. And that really comes from as soon as I start my first line of questioning with a patient about what's going on in their body, I want to make sure that my second question is coming from their first answer, right? That I'm actually listening to what are the words they're using to describe their symptoms? Are there patterns? Where does this fit into my clinical picture? But more so, what am I learning about this person's ability to show up, to make choices? Where do they feel they have that flexibility? Where do they feel like they're stuck? And how do I either open their eyes to, hey, maybe the gates are just in front of you and you look to the side and it's wide open? Or where do we say, okay, yeah, this is a place where you're going to get stuck and here's how we're going to work within these parameters. And so, I mean, just recently I was working with a patient. We were running into some areas where we weren't making the progress we wanted to. I was like, hey, here's an option. He was like, yeah, I'm not going to do that. I was like, great. Thanks for
Hmm.
being honest with me. We're not going to spend more time on this then. Here's three other directions you can go. What feels right for you? Right. And
Mm-hmm.
so I think being able to take feedback and move on quickly while still providing evidence based care, that's that's the central aspect of what we need to do.
Yeah. And we talk about leadership a lot and everything that you're sharing. I'm like, that's just good leadership, right? And so it's not about telling
Yeah.
somebody what to do. It's about being their guide, being their coach. Like you're a partner alongside their growth, their recovery, their to their benefit of performance. So whether you're a supervisor, whether you're a clinician, like putting on that leader coach hat is huge. And like Dr. Caroline shared a lot of examples. One is starting with clear expectations and communication, right? Here's my goals, and then someone might raise their hand like, well, that's not my goals. But the way you stated your example, I can't imagine anyone saying, okay, no, like that sounds good, right? Like we're going to do some tests, we're going to do some things, we're trying to get me back to optimal or the best for, today and next week and on and on. Like, yeah, that's why I'm here too. Cool. Next thing is you're talking about listening, right? Like how your response will depend on their response. And so, I just love the crossover there because when we're talking about how to make police better, how to make them more well, how to make them perform better, how to help that with the community interplay, like it's all the same stuff. It's like a lot of these tenets that you're so well describing, being like empathy, understanding, communication, teamwork. I mean, this could be a leadership clinic today if anyone just kind of plugs and plays their challenge into this thing.
Yeah, and I think, I have a personal soapbox. I hate the phrase, "This is a judgment-free space,"
Mm,
because to me, that really gives us the permission to be ignorant to what else might be happening. And instead, if we start looking at, within both professions, we're looking at how to equalize power dynamics, right? So, how do we instead be able to recognize we are human, we are social creatures, and by nature, social creatures use judgment to determine safety. But how do we also check in on that judgment and say, am I also using empathy in this moment? And so when you meet someone who might be showing up to a session and they might not agree with my objectives to say, we're going to do this evaluation, I'm going to give you this information, we're going to come up with a plan together. What else could be going on, right? Does this person just feel like they need a spot to be heard, right? Do they just need to get something off their chest? Do they need to feel like they can develop skills to advocate for themselves better? What else could be getting in between my goal and their goal? And how do I find that middle ground to be able to help them move forward better?
yeah. So Planet Fitness, that was like judgment free zone, or that was like their old tagline. Just making me think of that. I love how you are describing this like critical feedback. And feedback
Yeah,
is a gift. It's not easy to receive, but when it really works is when there's trust. And you're
right.
describing, or what you're describing, I'm thinking about vulnerability. And a lot of people they get kind of uncomfortable with the word because they don't want it to be weakness, and we need to rebrand that. But it's the same as like openness. It's the same as like letting someone in and letting them be an advocate. Again, it's that trust and team. And so I can definitely picture what you're saying. It's almost that um, that physical trainer that is pseudo therapist just because you're doing these really uncomfortable things and someone's in your corner. You're kind of in a quote unquote vulnerable space when you're not doing well, right? Like I can think about people
Yeah.
that some of my closest friends have grappled through injuries and they're just so dejected. But then when they're doing PT, they're doing these quote unquote really easy things. They're not easy at all. Like they're sweating, they're in pain. So I can see how that hat is so important.
Yeah, I think, we hear consistently from patients like, I'm just doing this tiny exercise. Why am I shaking and quaking? This is humbling. And we don't think of all the different areas where we create vulnerability. We have to be really mindful about the lead up to those. Because when we just assume that vulnerability will be present, that's when we start really playing with a much more dangerous area of where we're starting to build the models that reaffirm chronic pain or reaffirm the perseveration on stress. But when we instead start by building that space where vulnerability can exist, by building trust rather than assuming it, that's when we start being able to actually tackle these really hard challenges together in a way that oftentimes, like, I'll walk away from sessions and be like, whew, that felt good. Like we can tell when we're hitting right versus when it's like, yeah, this doesn't mesh. We need to do more work to build this space.
Yeah, yeah, absolutely. I know you shared how we can't over kind of I guess model this quote unquote average officer or this average injury. But are there some themes or things that you would generally recommend based on what you see are common injuries, like things that people can think about when they're designing their physical activity or exercise regimen, correctives, things like that?
Yeah, I mean, some of the most prominent, there's a study from Korean police officers. It looked at about 350 officers who had all visited their regional hospital within the last 12 months. And it looked at where is pain being reported? What are the variables that are going alongside? Some of the most prominent data was individuals who exercise are 2 times less likely to experience arm and hand pain. Those who have chronic diseases are about like 1.8% 1.8 times more likely to have an injury on the job. When we look at actually where those injuries are occurring, we're seeing a lot of shoulder, a lot of back, followed by neck. So we're really looking at like this upper trunk region. That's not to say, hey, let's spend all day bench pressing, right? But how are we
Might
looking
make it
at
worse.
robust Right. Well, how are we looking at robust exercises that are multiplanar, that are dynamic, that are working on the development of explosive power and then the recovery? Because really, the key here is are we training recovery in a way that's promoting performance? And so we talk, like in my sessions, I talk a lot about that experience of when you do something and you experience pain, you experience discomfort, you notice high heart rate, high breathing rate, high level of stress or an emotional response to the activity, then what are your active management strategies, right? Instead of being in that fight, flight, or freeze stage, what can we do to calm down the nervous system to allow ourselves to come back to that regulated zone so we know how to more accurately perceive the level of threat to our body? And that's essentially what we do during exercise. We put our body into a state of threat and then we recover. And the more we practice that, the better our brain gets at determining what is safe and what is not. So I think having that experience just in general, getting exercise is huge. Um, but if you're getting stuck, I think seeking, hey, is there an opportunity for prehab? Right? What can I do within my body to show up best for myself? How can I be proactive to make sure that this little twinge right now doesn't turn into something that's stopping me or giving me more stress?
Yeah. Yeah, can we do like a kind of rapid fire answer? Like what comes to mind when I throw a couple things at you?
Yeah, sure.
All right. So in that context, what is your favorite exercise movement for first responders?
This is going to be this is going to be your classic therapist answer for it to be it depends.
Oh man.
But yeah, it depends. I like to think of agility drills as high on my list though. Also practicing a lot of like sit to stand transfers, really making sure that you're getting that core engagement with lower body engagement and looking at all the different ways that you're doing that within your day to day. Because that's one of the most performed tasks in your job, whether it's out of a car or just out of your office chair. So making sure that we can do that and we're not using our momentum and using our hands and really leaning into our low back. Are we actually developing the strength and coordination to be able to do that? And then I know this isn't rapid fire anymore, but mixing strength and mobility. How are we integrating the two together?
Yeah, okay. So with the agility, I love that you went there because it makes me think of things I've learned about reactivity and being able to have that in injury prevention, like studies with elderly and those that can actually catch themselves is like related
Hmm.
to their injury, of course.
Yeah.
A lot of people might think about like the combine and ladder drills and running routes and stuff, but like what are some simpler things that people can think about and maybe look up on their own time when they're not driving on YouTube?
I mean, like burpees are a great example of something, A, for being able to catch yourself, but also being able to transfer positions. Ladder drills are a great one. Even just going into high intensity interval training, right? To be able to elevate heart rate, bring it back down. And this is looking more at that cardiovascular aspect. But there's all sorts of different options, and you can really take that question wherever you want to go, depending on your goals and where you're looking to make.
Nice. So when you say strength and mobility, I love it. What are some things that people can picture or what does that mean to you?
I like to think a lot about if you're noticing tension in a muscle group. Oftentimes, our only thought is, oh, I need to stretch it or I need to massage it, right? How often do we feel that tension in the shoulder and go, oh, I just need a massage,
Mm,
right? But if we start looking at what are the muscle groups around it and how are we making sure those activate? So, biggest things I think of are like the rotator cuff in the shoulder. We need to look at the shoulder as the entire girdle with the scapula, the humerus, the clavicle, and how those three bones are working with each other, how those joints are moving with each other, and how those muscles are supporting it to make sure that one isn't taking over for some underdeveloped or uncoordinated muscle groups. And then making sure, hey, are we also addressing thoracic mobility? Are we making sure that we're adding mobility in the places where it matters, not just stretching because we've heard stretching is good, right?
mhm,
Like, let's make it purposeful.
yeah. Not just stretching to stretch.
Yeah,
Yeah, it
which,
makes me
I
think of
mean,
intention.
stretching to stretch is better than nothing, don't get me wrong.
It's still movement, right? You're still likely to
Yeah,
find some pain point or kind of be have more body awareness perhaps.
yeah, and recent studies are really showing, like, any movement counts as exercise. We don't need to be in a gym for 60 minutes to count it as exercise. If you do 10 push-ups, that counts. If
Yeah.
you do 2 stretches, that counts. Everything you're doing, every choice you're making towards using your body to move, it builds.
Yeah, I love that. Yeah, it just helps remove some of the excuses. Like we can do 10 push-ups a day. We can do 10, sit to stand chair squats, right? Just really controlling the movement and the flow. We can take the stairs instead of the elevator. Like these are things we can
Right.
control easily in a busy, busy
Yeah.
day. Do you have a favorite recovery tool or maybe an underrated recovery tool or practice?
So, like I said at the beginning of the session, I specialize in concussion. So, I work with a lot of individuals who have dizziness, who have nausea, who have headaches. And one of my best symptom management strategies when people are pushing into that zone, and this also works with high exertion, is deep pressure. The nervous system really, really loves deep pressure. It's a very regulating sensation. So, almost every single patient, I train like palm to palm pressure when you're feeling like heart rate is going up there, if you're feeling like your emotions are starting to get out of control, palm to palm deep pressure, wall plank, or just an actual plank on the ground. My patients know I have a tagline of if you're going to be anxious, you're going to be anxious and strong, right? So
Mm.
every time you start feeling anxiety kick in, do something that makes you stronger, do something that makes you better at reacting and responding. So that way you're not just sitting in this like lukewarm misery. You're able to say, hey, I am doing something that is promoting my betterment.
What a cool habit stack. Okay, so for the listeners, you're basically just pushing your palms together in
Yeah.
front of your chest and pushing inward like opposite directions and
Yep.
to build that
Like you're
tension.
trying to create a lot of pressure, just squeezing the heck out of your palms.
Yeah. Yeah, that's cool. Yeah. I've been messing around with stuff like that. Like my kid has this like kickball and you can like kind of push it together and do lunges and it makes you feel really off balance, but I don't know. Just something for people to think about. It doesn't take a lot to burn some energy and create a challenge for yourself.
Yeah. But I mean, otherwise, I think planks are slept on. I think they're great full body exercise. And the fact that they're so good for the nervous system. It's like, hey, why not?
Yeah. Well, you heard it here. We're talking about burpees and planks, probably two of the most despised yet respected simple exercises, bodyweight exercises one could do.
Yeah, it's free, portable, and easy to use, right?
Yeah. Awesome. Well, man, we covered a lot of ground, Dr. Carolyn. I mean, we scratched the surface on some things. We went really deep on others. And I know it would be so fantastic to have you back. I really believe that whoever's listening to this will get a lot from it. I love how you're able to bring and bridge and overlap all these conversations that anyone listening in is going to be able to get a lot, including leadership. So thank you so much, Dr. Carolyn.
No problem. Thank you so much for having me. I really appreciate it.
Yeah, absolutely. So, again, thank you and ATI. Can you please tell people where they can reach out to learn more? You're building a lot, and I know that this is going to generate people wanting to reach out and be like, man, how can I adapt some of this ideology, or how can I learn more about working with you?
Absolutely. I'll make sure to provide my email, LinkedIn, so that way people are able to reach out directly to me, get right to a real human being. And then I'm happy to help facilitate conversations about how to make sure that these services can be more accessible in whatever neck of the woods people are coming in from.
Awesome. And that'll all be in the show notes. So if you're driving, don't look at it now. Get to where you're stopped. And again, thank you so much, Dr. Carolyn.
No problem.